The synthesis starts from actually a blood vessel is there. Near to the blood vessel we have a follicular cell. Always near the blood vessel we have a follicular cell. So in the follicular cell we have a basolateral end and an apical end. The basolateral end is adjacent to the blood vessel. The apical end is far away from the blood vessel. So the first one consider as a follicular cell. We have basolateral end as well as apical end. In the blood vessel, okay, which is adjacent, in the blood vessel we have iodine and sodium. Iodine and sodium. Suppose iodine and sodium is there in the blood vessel. This has to go to the follicular cell. So the iodine and sodium transports from the blood vessel to the follicular cells by a symporter known as sodium iodide symporter, NIS, sodium iodide symporter, which is a secondary active transport. Yes, an example for secondary active transport. Sodium iodide transporter or symporter does, what does it do? This iodide and sodium present in the blood vessel moves into the follicular cell by a symporter known as sodium iodide symporter. So the iodide and sodium is reaching the follicular cell now. Now you should know something about sodium iodide symporter here. This sodium iodide symporter is present in the thyroid gland. It's present in the parotid gland. It's also present in some other examples also. So thyroid gland is the what does it do? It means it is the capability of iodide uptake. It's an uptake of iodide. It is capable of uptaking the iodide. That is a function of the sodium iodide symporter, which is a secondary active transport. So this sodium and iodide is transported to the follicular cell now. Now we have iodide there. What happens to the iodide here? Immediately it shifts to outside. From the blood vessel it has come now to the follicular cell. From the follicular cell immediately, soon after it reaches here, it goes out of the follicular cell. Means to the apical end it goes out the follicular cell. So in replace of going out the iodide cell, we need some iodide ion. I mean, we have iodide ion going is a negative charged. We need some negative charge to be balanced. So the iodide ion goes out of the follicular cell. We need some negative ion to come into the follicular cell. So what ion comes here is chloride ion. So when the iodide ion coming from the blood vessel via the sodium iodide symporter, immediately the iodide goes out of the follicular cell. In replace to that, chloride ion comes inside the cell through an exchanger known as chloride iodide antiporter. There is an exchange taking place between iodide and chloride. So why it is happening? Why the iodide is going immediately out of the follicular cell? Because it is in the cell membrane bound enzyme. It is in cell membrane bound form. So this iodide going out is in a reduced form. It has to be oxidized. That's why the iodide is immediately going out. It's a cell membrane bound form as well as it's a reduced form. This has to be oxidized form. For our hormone synthesis to happen, it has to be in oxidized form. So the iodide has to go out of the cell. In replace to that, chloride ions comes inside the cell via a transporter known as chloride iodide exchanger or chloride iodide antiporter. So now iodide is outside. Now it has to be oxidized. Okay, the oxidized form of iodide takes place by the help of an enzyme known as TPO, thyroid peroxidase. So thyroid peroxidase is the enzyme which helps the reduced form of iodide to be oxidized form of iodide. That is the role of TPO, thyroid peroxidase. TPO, thyroid peroxidase, helps the reduced iodide form to convert into oxidized form of iodide. Okay. Now this iodide has to be converted to tyrosine. Now that is known as organification of iodide. The iodide, the reduced iodide form, oxidized form, it is converted to oxidized form. Now this oxidized iodide has to be converted, or it has to be incorporated into tyrosine. This incorporation of iodide into tyrosine is known as organification of iodine. So organification of iodine is nothing but the incorporation of the iodide, which is oxidized form, into tyrosine. Now we have a organification of iodide taking place. Now after organification, what happens? There is something known as coupling reactions. There are certain reactions occurring, that is coupling reactions. So we have now monoiodotyrosine, one iodide tyrosine, we have MIT now, which is known as MIT, monoiodotyrosine. Now one molecule of monoiodotyrosine combines with another molecule of monoiodotyrosine forming diiodotyrosine, DIT. Diiodotyrosine, DIT, combines with one more molecule of MIT, DIT plus MIT, now it forms T3, which is our important hormone, T3. DIT combines with MIT forming T3. Now, DIT combines with another molecule of DIT, it forms T4. If the MIT goes and binds to DIT, it's an ulta process, reverse process, it's known as reverse T3. Okay, so that is what we have. MIT plus MIT is DIT. Okay, DIT plus MIT we get T3, DIT plus DIT we get T4. MIT plus DIT means reverse T3. Okay, so reversely. Okay, so these many things are there. Now, we have, as I told you, sodium iodide symporter is there. if there are more excess levels of iodide transporting in this transporter, usually normal levels of iodide transported, and it has to happen for the synthesis of iodine to take place. So if more excess levels of iodine are transported through the sodium iodide importer, what happens? There is a condition known as Wolff-Chaikoff effect. Wolff-Chaikoff effect, WOLF, Wolff-Chaikoff, CHAIKOFF effect. Wolff-Chaikoff effect is nothing but the excess levels of iodide transporting into the follicular cell via the sodium iodide importer. This condition known as Wolff-Chaikoff effect. That can happen. Okay. Now we have the hormone. We got MIT, DIT, T3, T4. T3 and T4 is come now. Now what happens? This form. These forms are the hormone synthesized is stored in the form of a structure known as colloid. These hormones, what synthesized, is transported into the follicular cell in the form of colloid. It's stored in the form of colloid. Okay. So the colloid is a storage form. It can be stored or it can be reserved, act as a reservoir for 2 to 3 months. So the hormone synthesized is transported into the follicular cell in the form of colloid. It is stored. It can be stored for 2 to 3 months. And if you break this T3, T4, if you break the colloid, if you want to release the T3, T4, you can break the colloid so that T3 and T4 can be released into the blood vessel. So the hormone synthesized is transported into the follicular cell. It is stored as in the form of colloid, which can be stored for 2 to 3 months. If you want the release of T3 and T4, you have to break this colloid. Okay. So the release of T3 and T4 happens once the colloid is broken, and it goes to the blood vessel directly. So there is no duct happening here. There is a ductless gland. It's an endocrine gland because the hormones directly go to the blood vessel without any duct. Okay. That is the synthesis of thyroid gland. So I hope you understood the synthesis of thyroid gland.